Alright, today I want to talk about how to carry out Metatherapy protocol with your Metahunter device, with your NLS device, your biophilia tracker device, name them. Metatherapy is a programmed protocol that is used to reverse pathologies going on in the body. That antibiotic you took, that analgesic you took, the paracetamol, the cough medicine you took, when you ingested it, it actually generated a frequency, a healing frequency. That's the frequency that reverses the pathology. Now, the NLS device is a frequency generator. For you to run a Metatherapy protocol with your Metahunter device, you must run a fresh scan on that organ. Did you hear me? Otherwise, it will not be active for you. When you run Metatherapy 10 times, when I mean 10 times, the patient has come 10 different days. You rest for 2 weeks and allow the body to continue the healing process. After 2 weeks, you run a scan. If the pathology is still present, you resume another 10 sessions, 10 times of coming of Metatherapy. If you subscribe for my online masterclass course, you can have access to more information about this, both from my videos and from my lifelong coaching with you. So what are you waiting for? Go and subscribe for my online masterclass program, and you're going to learn much more. This is where I want to run Metatherapy on. I want to run Metatherapy on the arterial vessels where I found level 5s. This is how symptoms appear faster. So I run this, let me run it 5 times. You can see level 5s are disappearing. I reduce to level 4. Just one more level 5 left. Okay. Now, not to make this video too long, I will just do that Metatherapy one more time. Alright, today I want to talk about how to carry out Metatherapy protocol with your Metahunter device, with your NLS device, your biophilia tracker device, name them. Okay, I'm going to be showing you in details the protocol you need to observe when it comes to this treatment therapy, Metatherapy. Metatherapy is actually one of the most used treatment method in your NLS device. There are up to about 7 treatment options that you have with your NLS device. I know some of us may not know this. Some of us may think that the NLS device just does only scanning. Now know this and know peace. Your NLS device can run treatment. Your NLS device can run treatment. As a matter of fact, we have up to about 7 of them. Okay, let's start with the option of Metatherapy, which is the most commonly used. We have Metatherapy option. We have autotherapy, automatic therapy. This one makes it easy. When you do a full body scan, all you just need to do, if you don't really know how to use this device, is to click on autotherapy, and it is going to automatically run a Metatherapy on all the organs that has just been scanned. Just that you may need to do more than 1 session. Okay, so autotherapy is the second option. Then we have phytotherapy, plant therapy. Plant therapy is another treatment option you will find in your NLS device. It is using the frequency of plants that you find in your software to treat. Take for example, if you find bitter leaf, you will see it in botanical name. If you find bitter leaf amongst them and you want to use it to treat diabetes, all you just need to do is to click on the image of that of that plant, and it will start the process. Okay, and what it does is that it is going to be sending the frequency of bitter leaf into the organ that you want to treat. Take, for example, maybe you want to treat the pancreas or the islet of Langerhans. You can use the recorded frequency of bitter leaf to do the treatment. What it actually also means is that whether you use this frequency or you carry out or you literally consume bitter leaf naturally, it is going to give you the same result. I'll talk more on that later on. Or then the fourth option we have is lithotherapy. Lithotherapy is simply speaking of gemstone therapy. You may have seen some people wearing a necklace or handband or wristband of gemstones. It is going to give you the same result if you find that gemstone in the list recorded in the software, the NLS software. If you find things like amethyst, jade stone, and so on, it is the same work it's going to do without need of raw materials. That's how amazing your NLS device is. Okay, we have the fifth option of treatment by normal water remedy, where you are programmed water to reverse the pathology going on in any organ of the body. That is the fifth option. Remedy preparation, maybe using water, alcohol, or paraffins. That's the fifth treatment option. Okay. The sixth treatment option that we have is homeopathic remedy preparation. Preparing homeopathic remedy. You are going to see a list of homeopathic frequencies that have been programmed into your device. So it is either you use that frequency or you literally go and buy the homeopathic preparation from the pharmacy, and it's going to give you the same result. Honestly, this has been proven over time. Okay, and the seventh treatment option is physiotherapy. Physiotherapy. It is not the same as the literal physical physiotherapy, but the frequency that is generated from physiotherapy has also been recorded in the NLS software. And so when you click that option, it generates the same frequency, you use it to treat. So we have about 7 treatment options that you can carry out to treat organs that are dysfunctional. All right, and so, but today I just want to show you the major one, which is metatherapy. How to carry out that protocol. Just something simple I'll put out there, and you go home and keep practicing it on yourself and your patients, and you're going to see amazing results. But before I continue, I still want to reiterate, what I am about to show you now is already a module in our NLS and Metahunter course program. All right, if you subscribe, you will get more details about how to carry out metatherapy, phytotherapy, lithotherapy, physiotherapy, remedy preparation, homeopathic remedy preparation. These are all different modules that you will find in our NLS course program. If you have not subscribed for this online masterclass training, I don't know what you're waiting for. I don't know what you're waiting for, because several people have subscribed. As I speak to you, we have over 1,000 subscribers in 34 countries. The last time I mentioned 34 countries, not that it's just 34 countries, I have still been recording on a weekly basis more people in some of these countries who are subscribing for this course. Why? Because they are getting value. If they are not getting value, the number will not keep increasing. So what are you waiting for? So I'm going to encourage you to go and subscribe for my NLS Metahunter online masterclass pre-recorded video. to learn more about this. If you want to subscribe, please type on the comment section, I want to subscribe. And I'm going to guide you, I'm going to show you the link, I'm going to give you all the information that you need to make that happen. So just type on the comment section, I want to subscribe. I want to subscribe. I want to subscribe, and I'm going to share the information you need to help you to subscribe so that you can get on board increasing your knowledge on the NLS device, the Metahunter device, and so on. We have courses that will benefit you. Just go through our website. You are seeing the link on the screen. You're looking at the link on the screen. You will find different courses that will benefit you. We have a course on the 𝗘𝗡𝗦 device, over 200 video clips of about 35 reports on the 𝗘𝗡𝗦 device explaining abnormal organs, what symptoms you may experience, telling you definition of some of those parameters. When you see something like blood viscosity, what does it mean? When you see something like peristalsis, what does it mean, and so on. All those things were explained, and then lifestyle that can correct the abnormal organs, herbal supplements, all those suggestions were all there. It's an amazing package that if you have a quantum analyzer, you will need this course. Talking about, you are going to learn a lot about biology and human anatomy that will help boost your confidence in consulting with your 𝗘𝗡𝗦 device. So you will need this course. So we have a course on 𝗘𝗡𝗦 device, we have a course on NLS, Metahunter, we have a course on natural medicine. Some of us are selling products, but you will need some basic knowledge on natural medicine. You'll be able to prepare some things together, or even give beyond just giving your patient your products. There are some home remedies you can recommend for them, and they will thank you. They will recommend more people to you. You need to know some of these basic stuff. That's why you need to subscribe for our course in natural medicine. We have a certificate program in natural medicine, all pre-recorded videos that you can study at your pace. And we also have a full course with over 54 modules on the biophilia tracker device. The biophilia tracker device, will have a course on that. If you have the biophilia tracker device or you intend to buy, you are going to need that course. As a matter of fact, go and check comments on my YouTube channel. You will see people who are saying that that is the richest content you can find on the internet today. So what are you waiting for? I encourage you, go and subscribe, and you'll thank me later. Okay, so back to metatherapy. Back to metatherapy. Before I show you practical, metatherapy is a programmed protocol that is used to reverse pathologies going on in the body. The amazing shock that people are finding difficult to believe is that the NLS device, your Metahunter, your 9D, your 17D, your 3D, your biophilia tracker, they can all carry out treatment. They can all carry out treatment, not only diagnosis. They can carry out treatment. You may be wondering, how is this possible? Let me explain it to you. Okay, let me use this simple mathematics, arithmetics. +1 minus 1 is equal to what? 0. Minus 1 plus 1 is equal to what? 0. Now, the hypothesis behind the operation of this device, the Metahunter device, the NLS device, is simply telling us that every living organism oscillates, operates, functions at a particular frequency. All right. So if the microorganism responsible for let's say enteric fever, that's typhoid fever, that is Salmonella paratyphi or Salmonella typhimurium. If it attaches itself to, let's say, the liver, it will make the liver not to function at its natural frequency. That is how we're able to diagnose that, oh, this person is down with enteric fever, is down with typhoid fever. Okay, so That is a frequency that was measured. Assuming this frequency is classed into a number, I'm just trying to use layman English to help you understand how these pathologies can be reversed. It's the same way. You will send a direct reverse frequency to that organ of interest like a therapy, and it neutralizes the pathology going on, no matter how long it takes. Okay? I just mentioned -1 + 1 is equal to 0, assuming the pathology is running with a frequency of -1. If you want to neutralize it, you send a frequency of what? +1. Although we are dealing with frequencies, not whole numbers. Okay, but that is the principle by which pathologies are reversed. You are sending a direct reverse frequency. So when you run a metatherapy like this, you are actually sending a direct reverse frequency. When you prepare a remedy, when you program remedy with water, alcohol, or paraffins, or homeopathic remedy, you are programming a direct reverse frequency, and that is how these pathologies are reversed. That's how these pathologies are reversed. Now, let me shock you in case you don't know this. Even the herbal product you are taking, the orthodox product you are taking, the antibiotics, the paracetamols, the cough medicine that you are taking, every one of them generates its healing frequency. If you ask a chemist, a pharmacist who produce those drugs you take over the counter, they will just simply tell you it is the combination of some biochemical compounds that were synthesized. When you ingest it, it does the magic. But if you meet an energy medicine practitioner, the likes of the people who produce this kind of machine, the NLS device, they will tell you that antibiotic you took, that analgesic you took, the paracetamol, the cough medicine you took, when you ingested it, it actually generated a frequency, a healing frequency. That's the frequency that reverses the pathology. Now, the NLS device is a frequency generator. It's a frequency generator. This guy you see here is a frequency generator. When you put it in your head and it connects with your cerebral cortex, it is sending a frequency to the organ of interest that you selected to carry out, to generate a healing frequency or a reverse frequency, as it were, to reverse the pathology going on in the body. And that is how a person who is down with one pathology can get healing. So if it takes you 3 weeks of taking a drug to reverse a chronic disease, then you are likely to also run 3 weeks of metatherapy to get the same results. If it takes you 3 days to treat an acute condition, you may equally need 3 days. It depends on how bad the condition is. With this, we have practically reversed cancer of the breast, severe waist pain, headache, malaria symptoms, typhoid symptoms, shrink brain tumor, different conditions. For the few we have been privileged to handle through this metatherapy protocol, conditions have been reversed. You may not feel anything happen, you may not feel any vibration, but there is a vibration there's a vibration of electrons that are sent to our organs that is doing the magic. All right. So I just wanted you to understand the concept of metatherapy, and then we'll look practically into how to carry out this protocol. Well, let me spell it out. Let me spell it now. How to carry out metatherapy with your NLS device. First of all, let me tell you some peculiarities to some devices. The Metahunter in particular. Some of you don't know this, but please listen to me and take notes of this. Those of us that have the Metahunter device, you will notice that whenever you come the next day to run a metatherapy, you discover that the icon is not active, it's not green, it's not flagging green for you to go ahead. Please take note. For you to run a metatherapy protocol with your Metahunter device, you must run a fresh scan on that organ. Did you hear me? For you to run metatherapy on an organ, you must run a fresh scan that very day. Otherwise, it will not be active for you. Some of us may have been thinking, oh, something's wrong with my device, I'm not enjoying this device. No, that is how the Metahunter device has been programmed. You're going to thank me for this information because people have packed their Metahunter device thinking that it's not working. No, that is how the Metahunter device was programmed. For you to run a metatherapy, you must first run a scan on that organ that very day. Other models of NLS devices are not like that, but Metahunter has that peculiarity. Remember that it's one of the machines that does treatments faster than all other NLS devices. Okay, although the biofilter tracker treats faster than the Metahunter. So I will always recommend, if you can afford it, go for the biofilter tracker. If you want to order for it, contact me. If you want to order for the Metahunter or NLS device, you can contact me. Because there are fakes in the market out there, but I can supply you a reliable one that will not give you headache, that will give you accurate results. Okay? So I have mentioned that you will need to run a fresh scan for the Metahunter for you to do that. Okay. So now this is how to run a metatherapy protocol with your patient. Now, the idea is this. When you run a metatherapy, if you go and check the CSS results, assuming it was on a 0.323, which is quite low energy, when you run a metatherapy, you're going to discover that it's going to shoot way maybe above, let's say, 2.524, 1.783. It looks amazing. Oh, you see the person has recovered. Now, if you check the visual result, the visual analysis, symbols like level 6 that you were seeing may have changed to level 2, level 3, level 1, and so on. Now, please take note. That is an energy boost that has been given into that organ. You don't use that day's metatherapy to judge the healing status of your patient. Give it 24 hours, come and run the scan again the next day, then check the status level. Check the status level. Let me explain it this way. Assuming you run a scan and you looked at the CSS results of gastritis and it was on 0.323. When you run a metatherapy on that organ, assuming it's the anterior wall of stomach that you were running a metatherapy treatment on, by the time you run the metatherapy, it may shoot to 2.742 immediately. Okay? The entropy result may still remain on 7. All right? Don't get excited. Don't stop your metatherapy. The idea is 24 hours time, come and run a scan again and check that same results that gave you 0.323. It may not be on 1.724. Was it 1.724 I mentioned? It may not be on 1.724 again, but it may not either be on 0.323. It may have improved to, let's say, 0.527. That is how to monitor progress when you are treating your patients. You monitor progress that, oh, Today, before the scan, it was 0.323. When I came to run the scan 24 hours later, it's improved to 0.527. Or is that what I mentioned? I can't remember. Okay. The idea is that you want to take it to the healthy status. Okay, if you want to know the healthy status that required the frequency, subscribe for my online masterclass. You're going to see the required healthy status for every organ. All right. So, but this is how to monitor it. It's moving 0.323 to 0.724 to 0.92 something like that until it enters into healthy status. Now, that is not only the place to check. As a matter of fact, I don't judge healing with CSS results. I judge healing with entropy results. Entropy result. Entropy result is the main guy. Entropy result is trying to tell you whether the pathologies are present or not. Entropy result is trying to tell you whether that guy, the thief, is still there or not. So I want it to move from 7 to healthy status. If you want to know the healthy status for entropy results, subscribe for my online masterclass program, and you're going to see the healthy range that an organ can be said to be free of pathologies. Okay, so you are using entropy result. When you run your metatherapy, you are using entropy result to judge whether the person is free from cancer, whether the person is free from enlargement. We are using entropy results to check improvements. All right. So there is yet the protocol, the right protocol on when to stop and when to resume. Please take note of this. Your NLS device, your Metahunter device, your biophilia tracker device, when you run treatment with it, its main work is to give back the immune system the ability to heal itself. So please take note of this protocol. This is the main reason I did this video. I want to learn. Now listen, when you run metatherapy 10 times, what I mean 10 times, the patient has come 10 different days. You rest for 2 weeks and allow the body to continue the healing process. After 2 weeks, you run a scan. If the pathology is still present, you resume another 10 sessions, 10 times of coming of metatherapy. When you do that, you rest for another 2 weeks and allow the body to continue from there. That is the protocol for running metatherapy. You run 10 sessions, you rest for 2 weeks, you resume again if need be. Many people don't know this. That is the right protocol for running treatments with your patients. Whether phytotherapy, lithotherapy, physiotherapy, homeopathic remedy, normal remedy, metatherapy, autotherapy, that is the right protocol. If you forget this, I can help you. I just dropped this information for free that many of you don't know. But if you subscribe for my online masterclass course, you can have access to more information about this, both from my videos and from my lifelong coaching with you. So what are you waiting for? Go and subscribe for my online masterclass program, and you're going to learn much more. All right, so before I end this video, I'll just quickly drop a practical steps on how to run the metatherapy like I promised, and we'll end this video. Okay, so I want to do a practical demonstration on how to run metatherapy with your Metahunter device. Okay, so as it is now, I've already scanned about 4 organs. And for me to run metatherapy, I click on, let me select posterior wall of stomach. Let me see. Okay, let me select the pancreas. At least we have some level 4 there. Let's see how we can improve it to most of it to level 3 and so on. So I click on analysis, and you can see the metatherapy button. So the idea is to run metatherapy officially 5 times. Though you can run, I personally run more than that, depending on how chronic the condition is. Especially if the person is coming from very far distance, I personally run like 10 to 15 times on an organ, depending on how bad it is, if it has several level 6 and so on. All right, so but the recommended number of times per session is 5 times. Okay, so let me run it 5 times. So click on the start button. It by default is already on protector. So I click on start. Can you see the changes? You can see that some level 4 have changed to level 3. Okay, you can see the number of level 4 has reduced. So that's the first time. Let me run a second time. I click on start. So this is the second time. You can see that most of the level 4s are clearing out. I run a third time. I click on start. Okay. And now the 5th time. Okay, so that is how you run a metatherapy. Now, if you are working with a Metahunter device, assuming, I think in a previous video I have done on, I think I gave practical example on how the Metahunter device can hunt manually. Okay, assuming, okay, let me try to hunt. Let me try to hunt this area. Okay, so this is I'm trying to hunt so that if I can find a level 6 or a level 5. All right. Oh, okay, let me still hunt inside this histological section of arterial vessel. Okay, this is manual hunt. You can see I found a level 5. Now I want to treat that level 5. This is how symptoms disappear faster with the Metahunter device. Can you see? You can see we have level 5 here, and this is the blood vessel. All right, so this is where I want to run metatherapy on. I want to run metatherapy on the arterial vessels where I found level 5s. This is how symptoms appear faster. So I run this. Let's say, let me run it 5 times. You can see. You can see the level 5s are disappearing. It has reduced to level 4. Just one more level 5 left. Okay. Now, not to make this video too long, I will just do that metatherapy one more time. Okay, I click on start. Okay, level 5 is still there. So this is how on this particular inner organ, arterial vessels histological section of the pancreas. Remember, it was from the pancreas I ran it from. Let me try one more time. Maybe the level 5 will disappear. Okay, the level 5 has disappeared. So the idea is when I'm doing metatherapy with Metahunter, because I found level 5 when I hunted, so on those various levels, I have hunted up to 3 levels now. So I do metatherapy on this. If I want to leave this page, this particular page, you can see I come to this next one and run metatherapy on the tissue of the pancreas. This is a tissue on the pancreas. Okay, I'll just run this once. Run this once, but the idea is you run it like 5 times. All these various layers that you have hunted. Now, please take note. The idea is this. The official protocol is, like I mentioned, you run metatherapy 10 sessions. So we've already run metatherapy on this. If not, I would have done it. So that will be 3 layers. Okay. So the idea is this: you run metatherapy on a maximum of 5 organs, maximum of 5 times on each organs, and the advice is to run metatherapy on related organs. You can't be treating the pancreas and now jump down to the leg, the next organ. No. The pancreas is an organ of the gastrointestinal section. So if you want, the next organ you will want to treat is another gastrointestinal organ, maybe the liver, or maybe the kidney, or anterior wall of stomach, anything within the gastrointestinal section. Arrange it that way. Run metatherapy on 40 gastrointestinal sessions before you call it a day. That's the right protocol of carrying effective metatherapy. Run it 10 times, that's 10 sessions. The ones you are treating really needs to be related organs so that you can actually effectively monitor improvement, and that is how you get effective results from your treatment protocol. All right, that brings us to the end of today's class.